Greetings in the name of the Most High. Today, we're going to show you how to repair hypertension step by step. Because we did a video and a lot of people did not understand how to go about fixing hypertension. But we have a few people. Justin is one. Justin, you're good, man. And because Justin had severe hypertension, now his blood pressure is down to 114/71. I'm going to show you another brother who also had severe hypertension, who we are guiding, and how his pressure dropped back down by this diet, okay, and less stress, right? Now we know that your pressure could come from different places, so you have to find the cause of your pressure. Lots of people who have high blood pressure and severe, some of them are painters, some of them have mercury in their mouth, some of them is stressful. Some people have trouble in the kidneys. Some people have troubles in the heart. Some people have blockages in the arteries. Some people have troubles in the glands, and they contribute to also hypertension, right? But let's talk today about how to fix it step by step. Now, severe hypertension over here. Severe hypertension is 180 to 200 over 110. That's severe hypertension. Mild to moderate hypertension is 140 over 90, or 150 over 90, or 140 over 100. That's mild to moderate hypertension. Now once you're over here, your doctors try to put you on, or they do put you on medication, but when you have mild to moderate hypertension, they should not put you on drugs. Alright? That could fix this type of hypertension faster than drugs do. Alright? Now, so you have severe, and you have mild to moderate hypertension, and some of them call it essential hypertension, meaning that they don't know what caused you to have it. All right? Let's show you now, step by step, how you, the individual, can come off your medication once you find the cause of your hypertension. So once we are embarking on a program to remove you off the drugs, we make you take a 3-day fast, meaning that you clean the system out, and then you start taking lots of coconut water for the 3 days to flush out your kidneys now. And then you take lots of purified water, and you eat less food that have lots of sodium. And for the 3 days, only drinking liquids alone. On the 4th day, you start with your doctor's medication. So if you're taking a ACE inhibitor, or if you're taking a calcium channel blocker, or if you're taking a beta blocker, you have to know what they are, what it is. Well, how the drugs work now. You're going to be taking your beta blocker, ACE inhibitor, or channel blocker every other day, or your DAS, or your Beazide. That's called a water pill. Every other day. So you're taking your medication from the doctor every other day, but you're taking over here your herbal blend for the heart and for the kidneys and for circulation every day, and you're taking your supplementation every day. All of them over here, right? So Monday you take the doctor medication. Tuesday you don't take the doctor medication, but you take supplementations. You take your herbal blend. Wednesday, you take the herbal blend and the supplementation with your doctor's medication, but you're checking your pressure every day, and you're going to log it down twice per day. Once in the morning, last thing at night, you check your pressure. Now, if your pressure reads, let's go over here, 180 over 110, you have severe hypertension now. Now, after a week of doing the in and out with the doctor's medication and the supplementation and the herbal blend, you're going to see that your pressure start dropping to like 140 over 90, 140 over 100. You will know now that you are doing good things. So what you do, this one here, Dr. Med again, once you see when you are not taking this drug here, the doctor's medication, once you see your pressure stays normal while you're not taking this here, the doctor's drugs, and you keep on taking these here, then you skip another day of this. You skip 2 days. And after 2 days, and when you're not taking this drug again, you see that your pressure stays normal, you skip 3 days. And then you skip 4 days. And then you skip 5 days. But you keep on checking your pressure now. And you skip 6 days. And then you skip 7 days. And then what we do, we keep you on the supplementation and the herbal blend for the heart, which is what we call ginkgo horse chestnut, to help with circulation to the heart muscle and to remove plaque from the walls of the arteries. And then we give you healthy heart to keep the heart contracting well, to keep the pressure down, right? And also deal with Alzheimer's disease. This formula here, Alzheimer's disease and good circulation for the heart. And we keep you on these. Now, I want you to look at these here. Supplement for good heart health. CoQ10. You start off with 100 milligrams per day. And every week, you put another 100 milligrams with 100 milligrams until you get to what? 460 milligrams per day. Now, CoQ10 takes 3 months to get into the heart muscle. So you must take it for a while. So you're taking 100 milligrams per day, and you add 100 milligrams every week to make up 460 milligrams per day. And then you take your magnesium now. 600 milligrams every single day in the liquid form, the gel form, or the powder, not in the tablets now. Then you're taking L-taurine, 500 milligrams per day on an empty stomach, half an hour before your meals now. L-carnitine, which jumpstarts the heart, 500 milligrams per day on an empty stomach. And then buffer pH. You're taking your buffer pH now to buffer the system, to put the system back in an alkaline terrain, because your heart functions in an alkaline system. See? And while you're doing that now, you're checking your pressure. Now, lots of people who have hypertension carries a digital machine. They give you a wrong reading. See? So we ask you to get this is the real one. The best one to use is these here. The cuff. Learn to use them. And then they will give you a better reading. Now, you could take your pressure on your right hand. You're going to get a different reading than on your left hand, because this hand is nearer to the heart. And what we advise lots of women to do, especially women now, if you think your high blood pressure is coming from your thyroid gland, we ask you to lay down in the morning before you come out of bed, check your pressure laying down. And if your pressure reads, over here, Major, if the pressure reads 140 over 90 when you're laying down, and when you sit up, you check it again, and it says 150 over 100, your thyroid gland is messed up. So that has caused you to have troubles in your heart, right? Now, once we have you taking the doctor's medication every other day, and you wean yourself off of these drugs, then you have to keep yourself healthy by doing what? Having or eating foods that are healthy to your heart. So we're looking at lots of cucumbers, lots of celeries, lots of parsley, lots of green foods, lots of cell foods, because they help to alkaline your blood. And if you don't alkaline your blood, then the heart will suffer. And if you keep on eating fries and grease, and you're getting older, then your arteries become very hard. And then you become prone of coming down with troubles in your heart, including high blood pressure. Plus, you must keep the kidneys working well. You must have your kidneys producing renin, which is the hormone that keeps your heart well. And then once you come off the doctor medication, we keep you on these supplementation and the herbal blend for 1 month. And then we take you off all the herbs except CoQ10 and magnesium. And you're supposed to have your pressure normal forever and ever. Amen. Because the medical system never taught you to fix hypertension, because they never went and find the cause of it. Now we tell you now, once you could find the cause of your pressure, it could be coming from the kidneys, the adrenals, from stress, from mercury poisoning, from chemicals, from painting. All these are contributors to high blood pressure. Once you find the cause and you start taking these things in now, you could wean yourself off of these guys here by having discipline and using the food that help your heart. We call it what we call? We call them heart healthy foods. Alright? And that's how you wean yourself off. Now we have a patient now who started to use our products. And his pressure was, the first week he started, his pressure was 152 over 110. While taking all these things here, and skipping a day of the doctor's medication. Now he's taking every 2 days now. His pressure went from 152 over 110 to what? To 128 over 71. And he's amazed, showing him that he could do it. So you know what? Give God all the glory. Because he put us here on earth to help the people to heal themselves. Because your body heals itself if you give it the right nutrition. Give God the glory. Jehovah God the glory every single day. Follow this program here and you will fix high blood pressure. And then you will always call me and tell me the reading, how it reads, and then we could go day by day by me guiding you to come off these devil drugs that you'll be taking every day. You understand? Give Jehovah God the glory. Peace.